During these uncertain times when we're dealing with the impact of the COVID-19 coronavirus right here in Philadelphia where we live, I'll be joining you each afternoon to give you a quick update on where we stand and talk about another aspect of the science of what we know and what we don't know about this novel virus. Today, we know that there are over 3,500 cases of coronavirus here in the US, with 76 cases in Pennsylvania. As we look at the reports of who's getting affected around the world, one thing that has surprised everybody is the low numbers of children who are being seriously impacted by this virus. And scientists have been really curious to understand what's going on. One possibility is that kids could somehow be resistant to the virus. But another possibility is that kids are somehow more resilient to responding to the virus. And so now that we have some early data coming out of China, we can start to tell the difference between these two hypotheses. And it turns out, TLDR, that the second one is what seems to be happening. It's not that kids are somehow resistant to being infected. What we're seeing from these early data are that kids are getting infected, and you see those rates of infection going up over time. So that suggests that kids are getting infected just like adults are. But we also know that most kids are getting this infection likely through household contact because a parent or a caregiver in their home has been infected. So kids aren't necessarily getting exposed to some of the infections in healthcare scenarios or things like that. Now, we also know that the kids who are getting infected, though, do seem to have milder symptoms. Some of the early data from China show that around 10% of kids don't show any symptoms at all. And however, what that means is that we're probably not testing in children as much as we might be because we're not seeing symptoms. And so the number of kids who might be infected with coronavirus might actually be much, much higher than what we're documenting right now. And yet what we see is that there's very few deaths in children under the age of 9. So why is this? We don't really know yet, but scientists have some theories. One is that kids just have better immune systems than older people do. In childhood, the immune system is really gearing up. And so your body is making lots of B cells and T cells. These are the cells in your body that recognize and attack invading germs. As you get older, that the body starts to shut these systems down. You're not able to produce as many of these cells, and the ones that you have aren't as good at recognizing foreign germs. So this is the primary theory right now as to why kids aren't as deeply impacted by this infection. That being said, those kids who are compromised through some other existing health condition are certainly among the vulnerable populations to this disease, and we should be doing our absolute best to take care of them. Now, the question has been that given that kids don't seem to be as affected by this disease, what does that mean for some of the policy decisions that we're making? Here in Philadelphia, on Friday, the governor came out with a declaration that all schools would be closed for 2 weeks. What does that mean? And if kids aren't as affected, what kind of impact does that have? So it turns out that there are some different strategies for why and when you might want to close schools down in the middle of an epidemic. There's the short term, what we call a reactive school closure. So if there's a case of a student or a teacher or a parent within a school community, then a reactive school closure is to immediately shut the school down for a short period of time, often to just do a really thorough cleaning and then reopen. There's really no argument against doing that. That's definitely best practice. The harder judgment call is what we call proactive school closure. And that's what we're looking at now. When do administrators make the decision to close down a school before widespread cases of an epidemic? It's really a tough judgment call. There's data that kind of goes both ways. If we look at data from the 1918 flu, for instance, you can look at cities that closed down their schools early for a long period of time and see that there are fewer deaths in those cities than schools that waited longer. But those strategies were layered with other public health strategies for increasing social distancing. And so it was part of a broader strategy to prevent the spread of disease. Just closing schools isn't enough to do that. Now we're also seeing that there are countries that haven't closed schools down, and Singapore is the one that most people are looking at right now. Singapore has done a pretty good job of limiting the spread of coronavirus so far, and to date they haven't closed their schools. They're using a really aggressive strategy of testing to catch diseases early. They're screening people for potential fever or other symptoms every time they enter a public building. So there are potentially other strategies beyond closing schools outright that can help, again, minimize that public health impact. But the problem is that there's no way to know in advance whether you're making the right decision. So we're really relying on models, predictions of how the disease might behave and the role of children in potentially transmitting the disease to the grown-ups that they live with, and especially older adults and other vulnerable populations. And we just don't have a good sense of what role they're playing in that transmission of the disease throughout our communities. So the CDC in the US issued new recommendations about how schools might go about trying to make this decision. And it's tough. Because on one hand, even when, the models predict that the disease might spread, that there's community spread, where we don't know how the disease is spreading and, what role kids might play, for every argument you can make to close down schools, you also have to think about the social consequences of what happens to kids who rely on schools as a safe place to go for food, what's going to happen about learning as kids are out of school for a long period of time. So there are lots of consequences, even thinking about when kids are out of school, maybe they're being watched by their grandparents because their parents have to work. So this is one of these decisions where science doesn't give you a perfect answer. And this is really what public health is all about. So we'll be looking at many more of these decisions moving forward that are kind of tough calls to make. Whether it's talking about closing down restaurants and closing down schools, all of these will have long-term ripple effects. So stay tuned. We'll keep talking about this. I'll be back around 3 o'clock again tomorrow to talk about another aspect of the science. Thanks so much for joining us.